Certainly, let's explore the significance of bone mineral density, BMD, testing in the evaluation of musculoskeletal health. What is bone mineral density, BMD? Bone mineral density, BMD, is a measurement that quantifies the amount of minerals, primarily calcium and phosphorus, in a specific volume of bone. BMD is typically assessed using dual energy X-ray absorptiometry, DXA, a non-invasive imaging technique that provides precise measurements of bone density at various sites, often the hip and spine. BMD is a critical indicator of bone strength and overall skeletal health, and it helps assess the risk for conditions such as osteoporosis and fractures. Importance in assessing osteoporosis. One of the primary reasons BMD is used in musculoskeletal evaluations is to assess the risk of osteoporosis, a condition characterized by reduced bone density and increased fracture risk. Osteoporosis is often referred to as a silent disease because it can progress without symptoms until a fracture occurs. By measuring BMD, healthcare providers can identify individuals at higher risk for osteoporosis, particularly postmenopausal women, older adults, and those with certain risk factors such as a family history of osteoporosis or previous fractures. Early identification allows for timely intervention to prevent fractures and manage bone health. Monitoring treatment and progression. BMD testing is also valuable for monitoring the effectiveness of treatment in patients with osteoporosis or other bone-related conditions. After initiating treatment, such as bisphosphonates or hormone replacement therapy, BMD can be reevaluated after a couple of years to determine whether the treatment is working. An increase in BMD suggests that the treatment is effective in helping to build or maintain bone density, while a decrease may indicate the need for a change in the treatment strategy. This ongoing monitoring is essential for ensuring optimal patient care and preventing complications related to bone health. Guiding preventive strategies. In addition to diagnosis and treatment monitoring, BMD results can guide preventive strategies for individuals at risk for bone loss. If a patient is found to have low BMD, healthcare providers can recommend lifestyle changes such as increased weight-bearing exercise, dietary modifications to ensure adequate calcium and vitamin D intake, and fall prevention strategies. These interventions can help bolster bone health and reduce the risk of fractures. Regular BMD assessments can also help track the effectiveness of these preventive measures over time. In summary, bone mineral density, BMD testing, is a crucial component of musculoskeletal evaluations due to its role in assessing osteoporosis risk, monitoring treatment effectiveness, and guiding preventive strategies. Understanding the importance of BMD will enhance your ability to manage patients with musculoskeletal conditions effectively and promote overall bone health. Certainly. Let's delve into the significance of the erythrocyte sedimentation rate, ESR, in the context of musculoskeletal disorders. What is ESR? The erythrocyte sedimentation rate, ESR, is a simple blood test that measures how quickly red blood cells settle at the bottom of a test tube over a specified period, usually 1 hour. The rate at which the red blood cells fall is influenced by the presence of certain proteins in the blood that indicate inflammation. In musculoskeletal conditions, an elevated ESR can be an important marker for underlying inflammatory processes, making it a valuable tool for diagnosis and monitoring. Indicating inflammation. One of the primary reasons the ESR is used in musculoskeletal evaluations is its ability to indicate inflammation. In conditions such as rheumatoid arthritis, systemic lupus erythematosus, and polymyalgia rheumatica, the body's immune system produces inflammatory substances that can cause an increase in the ESR. When the ESR is elevated, it suggests that there is an ongoing inflammatory process, prompting further investigation to identify the specific cause and appropriate management strategies. Chakra-free. Differentiating conditions. The ESR test can also assist in differentiating between various musculoskeletal disorders. For instance, while both rheumatoid arthritis and osteoarthritis may present with joint pain, their underlying mechanisms and treatments differ significantly. An elevated ESR is more commonly associated with inflammatory arthritis, like rheumatoid arthritis, than with osteoarthritis, which is primarily degenerative. Thus, the ESR can help clinicians distinguish between these conditions and guide them in choosing the most effective treatment options. Monitoring disease activity and treatment response. Finally, the ESR is valuable for monitoring disease activity and treatment response in patients with chronic musculoskeletal conditions. Regular ESR testing allows healthcare providers to assess whether inflammation is under control and to evaluate how well a treatment regimen is working. If a patient's ESR decreases following treatment, it may indicate that inflammation is subsiding and that the treatment is effective. Conversely, if the ESR remains elevated or increases, this may signal that the condition is flaring up, prompting a reassessment of the treatment plan. In summary, the ESR test is an essential tool in the evaluation of musculoskeletal disorders, providing insights into inflammation, aiding in the differentiation of conditions, and helping to monitor disease activity and treatment response. Understanding the role of ESR will enhance your ability to interpret clinical scenarios in musculoskeletal medicine. Certainly. Let's explore the significance of measuring phosphate levels in the evaluation of musculoskeletal disorders. What is phosphate? Phosphate is a mineral that plays a crucial role in various bodily functions, including bone health, energy production, and cellular signaling. It is primarily found in bones and teeth, where it combines with calcium to form hydroxyapatite, the mineral complex that provides structure and strength to bones. Phosphate exists in the body in various forms, but the most relevant for testing is inorganic phosphate, which circulates in the blood and is essential for various physiological processes. Importance in bone health. Phosphate is vital for maintaining healthy bones, as it works closely with calcium to ensure proper bone mineralization. An adequate balance of phosphate and calcium is essential for bone formation and maintenance. Low phosphate levels, hypophosphatemia, can lead to weakened bones, which may result in conditions such as osteomalacia in adults or rickets in children. By measuring phosphate levels, healthcare providers can identify deficiencies that may contribute to bone health issues, allowing for timely intervention and management. Role in metabolic disorders. Phosphate levels can also provide insights into underlying metabolic disorders that affect the musculoskeletal system. Elevated phosphate levels, hyperphosphatemia, can occur in conditions such as chronic kidney disease, where the kidneys are unable to excrete excess phosphate. This imbalance can lead to the softening of bones and calcification of soft tissues, contributing to pain and discomfort. By assessing phosphate levels, healthcare providers can identify potential metabolic disturbances that may be impacting bone health and guide further evaluation or treatment. Guiding treatment and prevention. Measuring phosphate levels is important for guiding treatment and preventive strategies in patients with musculoskeletal disorders. If low phosphate levels are identified, healthcare providers may recommend dietary changes or phosphate supplementation to help restore normal levels. This is especially important for individuals at higher risk for bone-related conditions, such as those with malabsorption issues or certain genetic disorders. By addressing phosphate imbalances, healthcare providers can improve bone health, enhance overall musculoskeletal function, and reduce the risk of fractures and other complications. In summary, measuring phosphate levels is a crucial aspect of musculoskeletal evaluations due to its essential role in bone health and metabolic processes. Assessing phosphate levels helps identify deficiencies or imbalances that can lead to bone disorders and guides treatment strategies to promote optimal musculoskeletal health. Understanding the significance of phosphate will enhance your ability to manage patients with musculoskeletal conditions effectively. Certainly. Let's discuss the significance of the rheumatoid factor, RF test, in the context of musculoskeletal disorders. What is rheumatoid factor? Rheumatoid factor, RF, is an antibody that can be present in the blood of individuals with autoimmune diseases, particularly rheumatoid arthritis, RA. RF is produced by the immune system and targets the body's own tissues, leading to inflammation and damage, especially in the joints. The RF test measures the level of these antibodies in the blood, helping healthcare providers assess the likelihood of certain autoimmune conditions. Indicating rheumatoid arthritis. One of the primary uses of the RF test is to help diagnose rheumatoid arthritis. In individuals with RA, RF is often found in elevated levels, though it can also be present in other conditions or even in healthy individuals. A positive RF test, combined with clinical symptoms such as joint pain, swelling, and morning stiffness, can strengthen the diagnosis of RA. Understanding the presence of RF helps clinicians categorize the type of arthritis and determine the most appropriate treatment strategies. Differentiating conditions. RF testing is also valuable in differentiating between various musculoskeletal disorders. While a positive RF test is most commonly associated with rheumatoid arthritis, it can also be found in other autoimmune diseases, such as Sjogren's syndrome and systemic lupus erythematosus, as well as in some chronic infections. By evaluating RF levels alongside other clinical findings and laboratory tests, healthcare providers can better distinguish between these conditions, which is critical for effective management and treatment. Monitoring disease activity and treatment response. In addition to its role in diagnosis, RF levels can be useful for monitoring disease activity and treatment response in patients with rheumatoid arthritis. While RF itself is not a direct measure of inflammation, changes in RF levels over time can provide insights into disease progression. If a patient's RF levels decrease after starting a treatment regimen, it may indicate that the disease is becoming more controlled. Conversely, persistently high RF levels, despite treatment, may suggest that the disease is still active or that the treatment plan needs adjustment. In summary, the RF test is an important tool in the evaluation of musculoskeletal disorders, particularly rheumatoid arthritis. It aids in diagnosis, helps differentiate between various conditions, and can assist in monitoring disease activity and treatment effectiveness. Understanding the role of RF will enhance your clinical competence in managing musculoskeletal conditions effectively. Certainly, let's discuss the significance of measuring calcium levels in the evaluation of musculoskeletal disorders. What is calcium? Calcium is a vital mineral that plays several crucial roles in the body, particularly in maintaining bone health. About 99% of the body's calcium is stored in the bones and teeth, where it provides structural strength and density. The remaining 1% is found in the blood and soft tissues, where it is involved in various physiological processes, including muscle contraction, nerve transmission, and blood clotting. Because of its importance in these functions, measuring calcium levels is essential in assessing musculoskeletal health. Importance in bone health. One of the primary reasons calcium levels are evaluated in musculoskeletal tests is their direct impact on bone health. Adequate calcium intake is essential for building and maintaining strong bones. Low calcium levels, hypocalcemia, can lead to weakened bones, increasing the risk of conditions such as osteopenia and osteoporosis, which are characterized by reduced bone density and increased fracture risk. By measuring calcium levels, healthcare providers can identify deficiencies that may contribute to the development of these conditions, allowing for early intervention and appropriate management. Detecting metabolic disorders. Calcium levels can also be indicative of underlying metabolic disorders that affect bone health. For example, Conditions such as hyperparathyroidism can lead to elevated calcium levels, hypercalcemia, often resulting in bone pain, weakness, and increased fracture risk due to the release of calcium from bones into the bloodstream. Conversely, low calcium levels can be associated with vitamin D deficiency or certain gastrointestinal disorders that affect calcium absorption. By assessing calcium levels, healthcare providers can gain insights into potential metabolic disorders that may be impacting the musculoskeletal system. Jakurwan. Guiding treatment and prevention. Measuring calcium levels is important for guiding treatment and preventive strategies in patients with musculoskeletal disorders. If low calcium levels are identified, healthcare providers can recommend dietary changes, calcium supplementation, or other interventions to help restore normal levels. This is particularly important for individuals at higher risk for bone-related conditions, such as postmenopausal women or those with chronic kidney disease. By addressing calcium imbalances, healthcare providers can improve bone health, enhance overall musculoskeletal function, and reduce the risk of fractures and other complications. In summary, measuring calcium levels is a crucial component of musculoskeletal evaluations due to its essential role in bone health and metabolic processes. Assessing calcium levels helps identify deficiencies or imbalances that can lead to bone disorders and guides treatment strategies to promote optimal musculoskeletal health. Understanding the significance of calcium will enhance your ability to manage patients with musculoskeletal conditions effectively. Absolutely. Let's explore the significance of C-reactive protein, CRP, in the evaluation of musculoskeletal disorders. What is CRP? C-reactive protein, CRP, is a protein produced by the liver in response to inflammation. When the body is undergoing an inflammatory process, such as an infection or injury, CRP levels in the blood can rise significantly. The CRP test measures the concentration of this protein in the bloodstream, providing a quick and effective way to assess whether inflammation is present. In the context of musculoskeletal disorders, CRP serves as a crucial biomarker for diagnosing and monitoring various inflammatory conditions. Indicating inflammation. One of the primary uses of the CRP test in musculoskeletal evaluations is to indicate the presence and intensity of inflammation. Conditions such as rheumatoid arthritis, ankylosing spondylitis, and psoriatic arthritis are characterized by significant inflammatory responses. Elevated CRP levels can suggest that these conditions are active and may help differentiate them from non-inflammatory musculoskeletal disorders like osteoarthritis. By measuring CRP, healthcare providers can better understand the underlying processes affecting the patient and tailor treatment plans accordingly. Monitoring disease activity. CRP is particularly useful for monitoring disease activity in patients with chronic inflammatory conditions. Unlike some other inflammatory markers, CRP levels can rise and fall relatively quickly in response to changes in inflammation. This makes it an effective tool for assessing how well a treatment is working. For example, if a patient with rheumatoid arthritis starts a new medication and their CRP level decreases, it indicates that inflammation is reducing and the treatment is likely effective. Conversely, if CRP levels remain high or increase, it may suggest a flare-up or insufficient response to treatment, prompting further evaluation. Assessing treatment response. In addition to monitoring disease activity, CRP levels can be used to evaluate the effectiveness of treatment interventions. For instance, when a physician prescribes anti-inflammatory medications or corticosteroids, they may order CRP tests to see how the patient's inflammation responds to these therapies. A reduction in CRP levels can help confirm that the treatment is working, while persistently elevated levels may indicate the need for adjustments in the treatment plan. This dynamic monitoring is crucial for optimizing patient care and ensuring that individuals receive the most appropriate therapies for their conditions. In summary, The CRP test is an essential component of musculoskeletal evaluations, providing valuable information about inflammation, disease activity, and treatment response. Understanding the role of CRP will enhance your clinical skills in assessing and managing musculoskeletal disorders effectively. Certainly. Let's explore the significance of measuring vitamin D levels in the evaluation of musculoskeletal disorders. Marurun. What is vitamin D? Vitamin D is a fat-soluble vitamin that plays a crucial role in maintaining bone health and overall musculoskeletal function. It helps the body absorb calcium and phosphorus, which are essential minerals for building and maintaining strong bones. There are two main forms of vitamin D, D2, ergocalciferol, and D3, cholecalciferol, with D3 being the form that is produced in the skin in response to sunlight. Adequate levels of vitamin D are necessary to prevent bone-related disorders and to support muscle function. Importance in bone health. One of the primary reasons vitamin D is included in musculoskeletal evaluations is its critical role in bone health. Insufficient vitamin D levels can lead to a decrease in calcium absorption, resulting in weakened bones and conditions such as osteomalacia in adults and rickets in children. Osteomalacia is characterized by soft and brittle bones, which can lead to increased risk of fractures and musculoskeletal pain. Therefore, assessing vitamin D levels helps healthcare providers determine if a patient has a deficiency that could contribute to bone health issues. Impact on muscle function. In addition to its role in bone health, vitamin D is also important for muscle function. Research has shown that vitamin D deficiency can lead to muscle weakness and an increased risk of falls, particularly in older adults. Muscle strength is essential for maintaining mobility and preventing injuries, and vitamin D plays a role in muscle protein synthesis. By measuring vitamin D levels in patients with musculoskeletal complaints, healthcare providers can identify deficiencies that may be contributing to muscle weakness and related symptoms. Guiding treatment and prevention. Measuring vitamin D levels is also important for guiding treatment and preventive strategies in patients at risk for musculoskeletal disorders. If a patient is found to have low vitamin D levels, healthcare providers can recommend supplementation and dietary changes to help restore adequate levels. This is particularly important for individuals with limited sun exposure, certain medical conditions, or dietary restrictions that may affect vitamin D intake. By addressing vitamin D deficiency, healthcare providers can improve bone density, enhance muscle strength, and reduce the risk of fractures and falls. In summary, vitamin D measurement is a vital component of musculoskeletal evaluations due to its essential roles in bone health and muscle function. Assessing vitamin D levels helps identify deficiencies that can lead to bone-related disorders and muscle weakness. Understanding the importance of vitamin D will enhance your ability to manage patients with musculoskeletal conditions effectively and promote overall health. Certainly, let's discuss the significance of the anti-nuclear antibody (ANA) test in the evaluation of musculoskeletal disorders. What is ANA? Anti-nuclear antibodies, ANA, are a group of autoantibodies produced by the immune system that target substances within the nucleus of cells. These antibodies can be indicators of autoimmune diseases, where the body's immune system mistakenly attacks its own tissues. The ANA test measures the presence and level of these antibodies in the blood, making it a valuable tool for diagnosing various autoimmune conditions, including those that affect the musculoskeletal system. Screening for autoimmune diseases. One of the primary uses of the ANA test in musculoskeletal evaluations is to screen for autoimmune diseases such as systemic lupus erythematosus, SLE, Sjogren's syndrome, and mixed connective tissue disease. These conditions often present with musculoskeletal symptoms, including joint pain and inflammation. A positive ANA test suggests that an autoimmune process may be occurring, prompting further investigation to identify the specific disease. This is especially important because some autoimmune diseases can have overlapping symptoms, making accurate diagnosis critical for effective treatment. Differentiating conditions. The ANA test is also helpful in differentiating between various autoimmune disorders. While a positive ANA can indicate the presence of an autoimmune disease, it is not specific to one condition. For instance, ANA can be positive in lupus, rheumatoid arthritis, scleroderma, and even in some healthy individuals. However, the pattern of the ANA can provide clues about the specific condition. Different patterns, like homogeneous, speckled, or nucleolar, can be associated with particular diseases, aiding clinicians in narrowing down the diagnosis and determining the most appropriate management strategies. Monitoring disease activity and treatment response. In addition to its diagnostic utility, the ANA test can also be used to monitor disease activity and treatment response in patients with autoimmune diseases. For example, in lupus, changes in ANA levels can reflect changes in disease activity. If a patient's ANA becomes more positive or the pattern changes significantly, it may indicate a flare-up of the disease that requires closer monitoring or a change in treatment. Conversely, a decrease in ANA levels after starting treatment can suggest that the disease is becoming more controlled, providing valuable feedback on the effectiveness of the therapeutic approach. In summary, the ANA test is an important tool in the evaluation of musculoskeletal disorders, particularly those associated with autoimmune diseases. It aids in screening for autoimmune conditions, helps differentiate between various disorders, and can be valuable for monitoring disease activity and treatment response. Understanding the role of ANA will enhance your clinical skills in diagnosing and managing musculoskeletal conditions effectively. Certainly. Let's discuss the significance of joint aspiration and synovial fluid analysis in the evaluation of musculoskeletal disorders. What is joint aspiration? Joint aspiration, also known as arthrocentesis, is a procedure in which a healthcare provider uses a needle to withdraw synovial fluid from a joint space. This procedure is commonly performed on joints such as the knee, hip, or shoulder, where fluid accumulation, effusion, may occur due to various conditions. Joint aspiration serves both diagnostic and therapeutic purposes. By analyzing the synovial fluid, healthcare providers can gain valuable insights into the underlying cause of joint symptoms such as pain and swelling. Importance in diagnosing conditions. One of the primary reasons for performing joint aspiration and analyzing synovial fluid is to diagnose specific joint conditions. Synovial fluid analysis can help differentiate between various types of arthritis, such as osteoarthritis, rheumatoid arthritis, and infectious arthritis, septic arthritis. The characteristics of the fluid, such as its appearance, viscosity, and cell count, can provide crucial information. For example, cloudy or turbid fluid may indicate infection or inflammation, while clear fluid may suggest osteoarthritis. Additionally, the presence of specific cells, like white blood cells, and crystals, such as uric acid crystals in gout, can further aid in diagnosing the underlying condition. Therapeutic benefits. In addition to diagnostic purposes, joint aspiration can also provide therapeutic benefits. When a joint is swollen and painful due to excess synovial fluid, aspiration can relieve pressure and improve comfort for the patient. Removing the fluid can help restore normal joint function and mobility, allowing patients to engage in physical activity more easily. In some cases, corticosteroids may be injected into the joint space during the aspiration procedure to reduce inflammation and provide further relief. Guiding treatment decisions. Finally, the analysis of synovial fluid can guide treatment decisions. For instance, if the analysis reveals an infection, prompt antibiotic treatment can be initiated. If crystals are found in the fluid, such as in cases of gout, Specific medications can be prescribed to manage the condition. Additionally, understanding the underlying cause of joint symptoms through synovial fluid analysis allows healthcare providers to tailor treatment plans to the individual needs of the patient, improving overall outcomes. In summary, joint aspiration and synovial fluid analysis are essential tools in the evaluation of musculoskeletal disorders. They help diagnose various joint conditions, provide therapeutic relief, and guide treatment decisions. Understanding these procedures will enhance your ability to assess and manage patients with joint-related issues effectively. Sure, let's explore the significance of measuring uric acid levels in the evaluation of musculoskeletal disorders, particularly in the context of gout. What is uric acid? Uric acid is a waste product formed from the breakdown of purines, substances found in various foods, and the body's own cells. Under normal circumstances, uric acid is dissolved in the blood and eliminated through the kidneys in urine. However, when uric acid levels become too high, a condition known as hyperuricemia, it can lead to the formation of urate crystals, which can deposit in joints and tissues, causing inflammation and pain. This is particularly relevant in the diagnosis and management of gout, a common form of inflammatory arthritis. Diagnosing gout. One of the primary uses of uric acid testing in musculoskeletal evaluations is to help diagnose gout. Gout typically presents with sudden and severe pain, redness, and swelling in the affected joints, often starting in the big toe. Elevated uric acid levels can indicate an increased risk of gout attacks, and measuring uric acid can help confirm the diagnosis. While not all patients with high uric acid levels will develop gout, the presence of elevated levels in conjunction with characteristic joint symptoms can strongly suggest a gout diagnosis. Monitoring treatment and disease management. In addition to diagnosis, uric acid levels are used to monitor treatment effectiveness and disease management in patients with gout. When a patient is diagnosed with gout, healthcare providers often recommend lifestyle changes and medications to lower uric acid levels. Regularly measuring uric acid levels helps determine whether these interventions are working. Ideally, uric acid levels should be kept below a certain threshold, usually around 6 mg/dL, to prevent gout flares and long-term joint damage. If uric acid levels remain elevated despite treatment, it may indicate the need for a change in the treatment plan. Assessing risk of other conditions. Measuring uric acid levels is also important for assessing the risk of other health conditions. Elevated uric acid levels are associated not only with gout, but also with other health issues, such as kidney stones and metabolic syndrome. In some cases, hyperuricemia may be a sign of underlying kidney dysfunction, where the kidneys are unable to effectively eliminate uric acid. Understanding a patient's uric acid levels can provide a broader picture of their health and help guide further investigations or preventative measures. In summary, measuring uric acid levels is a crucial part of evaluating musculoskeletal disorders, especially gout. It aids in diagnosing the condition, monitoring treatment effectiveness, and assessing the risk of other health issues. Understanding the role of uric acid will enhance your ability to manage patients with musculoskeletal diseases effectively. Certainly, let's discuss the significance of the Basic Metabolic Panel, BMP, in the evaluation of musculoskeletal disorders. What is BMP? The Basic Metabolic Panel, BMP, is a blood test that measures several key components in the blood, including electrolytes, sodium, potassium, chloride, bicarbonate, blood urea nitrogen, BUN, creatinine, and glucose. These measurements provide valuable information about a person's metabolic state, kidney function, and the balance of electrolytes in the body. While the BMP is primarily used to assess overall health and metabolic function, it can also play a role in the evaluation of musculoskeletal disorders. Assessing kidney function. One of the important aspects of the BMP is its ability to assess kidney function. The kidneys play a crucial role in filtering waste products from the blood and maintaining the balance of electrolytes. In patients with musculoskeletal disorders, especially those with conditions that may lead to kidney stress or damage, such as gout, chronic inflammatory diseases, or prolonged use of certain medications, monitoring kidney function through BMP is essential. Elevated levels of creatinine, or BUN, can indicate impaired kidney function, prompting further evaluation and management to prevent complications. Evaluating electrolyte imbalances. Another key aspect of the BMP is the measurement of electrolytes, which are vital for various physiological functions, including muscle contraction and nerve signaling. Electrolyte imbalances can lead to muscle cramps, weakness, and even spasms, which may mimic or exacerbate musculoskeletal symptoms. For example, a low potassium level, hypokalemia, can contribute to muscle weakness, while elevated calcium levels, hypercalcemia, can indicate underlying conditions that may affect bone health. By assessing these electrolyte levels, healthcare providers can identify and address potential imbalances that could impact musculoskeletal health. Monitoring metabolic health and treatment. Finally, the BMP can be useful in monitoring metabolic health and the effects of treatment in patients with musculoskeletal disorders. For instance, patients receiving long-term treatment with corticosteroids or non-steroidal anti-inflammatory drugs, NSAIDs, may be at risk for changes in glucose levels, kidney function, and electrolyte balance. Regular BMP testing allows healthcare providers to track these parameters over time, ensuring that any adverse effects of treatment are identified early. This proactive approach helps tailor treatment plans to optimize patient outcomes while minimizing risks. In summary, the Basic Metabolic Panel, BMP, is an important diagnostic tool in the evaluation of musculoskeletal disorders. It helps assess kidney function, evaluate electrolyte imbalances, and monitor metabolic health and treatment effects. Understanding the role of BMP will enhance your ability to provide comprehensive care for patients with musculoskeletal conditions. Absolutely. Let's explore the significance of anti-citrullinated protein antibodies, ACPA, in the context of musculoskeletal disorders, particularly rheumatoid arthritis. What are ACPAs? Anti-citrullinated protein antibodies, ACPA, are a specific type of autoantibody that the immune system produces against proteins that have undergone a process called citrullination. Citrullination is a post-translational modification where the amino acid arginine is converted to citrulline, which can alter the structure and function of proteins. In rheumatoid arthritis, RA, the presence of these antibodies is a key marker and can help in diagnosing the disease even before clinical symptoms become apparent. Diagnosing rheumatoid arthritis. One of the primary uses of the ACPA test is to aid in the diagnosis of rheumatoid arthritis. While other tests, such as rheumatoid factor, RF, can be elevated in various conditions, ACPA is more specific to RA. Elevated levels of ACPA can often be detected years before the onset of clinical symptoms, making it a valuable tool for early diagnosis. Identifying ACPA-positive patients allows healthcare providers to initiate treatment earlier, potentially slowing disease progression and minimizing joint damage. Differentiating between conditions. ACPA testing is also important for differentiating rheumatoid arthritis from other forms of arthritis. While RF can be positive in several autoimmune diseases, and even in healthy individuals, ACPA is more closely associated with RA. This specificity can help clinicians distinguish RA from other types of inflammatory arthritis, such as osteoarthritis or psoriatic arthritis. By recognizing the presence of ACPA, healthcare providers can tailor treatment plans more effectively based on the specific condition. Monbru. Monitoring disease progression and treatment response. In addition to its diagnostic utility, ACPA levels can be used to monitor disease progression and treatment response in patients with rheumatoid arthritis. Studies have shown that ACPA positivity is associated with a more aggressive disease course, including more significant joint damage. By tracking ACPA levels over time, healthcare providers can gain insights into how well a treatment is working and whether the disease is progressing. If a patient's ACPA levels remain high despite treatment, it may indicate the need for adjustments in the therapeutic approach to better manage the condition. In summary, ACPA testing is a crucial component in the evaluation of musculoskeletal disorders, particularly rheumatoid arthritis. It assists in early diagnosis, helps differentiate RA from other conditions, and can be valuable for monitoring disease progression and treatment outcomes. Understanding the role of ACPA will enhance your ability to diagnose and manage musculoskeletal diseases effectively. Certainly. Let's explore the importance of the complete blood count, CBC, in the context of musculoskeletal disorders. Understanding CBC. The complete blood count, CBC, is a comprehensive blood test that evaluates various components of blood, including red blood cells, RBCs, white blood cells, WBCs, hemoglobin, hematocrit, and platelets. Each of these components provides valuable information about a patient's overall health and helps identify a range of conditions. In musculoskeletal disorders, the CBC can be particularly useful in detecting underlying issues that may be contributing to symptoms like pain, swelling, or fatigue. Identifying anemia. One of the primary uses of the CBC in musculoskeletal evaluations is to check for anemia. Anemia, characterized by a low hemoglobin level or a decreased number of red blood cells, can lead to fatigue, weakness, and reduced physical endurance. For patients with chronic musculoskeletal conditions such as rheumatoid arthritis or lupus, anemia can be a common complication due to chronic inflammation. Identifying anemia allows healthcare providers to address not only the musculoskeletal issue, but also the underlying cause of the anemia, which may require further investigation or treatment. Assessing infection and inflammation. The CBC also plays a crucial role in assessing infection and inflammation. The white blood cell count, WBC, is particularly important as it indicates the body's response to infection or inflammation. An elevated WBC count can suggest the presence of an infection, which is critical to consider in cases where a musculoskeletal infection, such as septic arthritis or osteomyelitis, is suspected. Additionally, the differential count of WBCs can help identify specific types of immune responses or infections, guiding appropriate treatment. Monitoring treatment and disease progression. Finally, the CBC can be used to monitor the effectiveness of treatments for various musculoskeletal conditions. For instance, if a patient is undergoing treatment for rheumatoid arthritis, regular CBC testing can help assess how well the body is responding to medications and whether there are any adverse effects, such as bone marrow suppression. By tracking changes in blood counts over time, healthcare providers can make informed decisions about modifying treatment plans to optimize patient care. In summary, the CBC is a valuable tool in the evaluation of musculoskeletal disorders, helping to identify anemia, assess infection and inflammation, and monitor treatment efficacy. Understanding these aspects of the CBC will help you appreciate its role in the broader context of musculoskeletal health.